So how many of you, after going through yesterday, how many of you are excited about going back to practice tomorrow? Everybody, right? So one of the things that I noticed when we actually did this event the first time out in Houston is that there seems to be a little bit different energy that you get from doing this event as compared to maybe going to other functional medicine events. And that's kind of exciting because it allows you to kind of begin to see your practice in a little bit different light than maybe what you have kind of thought about it previously. And starting off today, I hope today is going to be a continuation of that for you. What we're going to get going with here this morning is looking at how to set up a nutritional pharmacy. Now, when you think about this, most of us, we go to seminars, probably most of us sitting in here, we're all pretty proactive individuals, or we wouldn't be sitting in here. We tend to visit a lot of seminars, try to obtain as much information as we can. And in doing so, we bring products into our practices, and we do it with the thought process of, I'm going to help this patient, or I've got this group of patients that I'm going to help, but we really don't ever look at it and think about it from a business standpoint. It's just kind of products sitting on the shelf that will apply to a patient. So I want to give a little bit different viewpoint on that as we go through and really talk about how do you implement, or how do you manipulate your nutritional pharmacy so that it still remains effective from a clinical standpoint, but that also it's making you money and you don't have products that are just sitting there. How do you streamline your nutritional pharmacy from point A to point Z? Okay? Now, let me give you a little quick background on myself and kind of tell you why Dr. Osborne has me up here talking to you. Like every one of you in here, I'm in practice. I'm seeing patients just like you are. And that's just one hat I wear. The other hats I wear is that I've been a consultant to the nutritional industry for actually probably a little over 8 years now. And in doing that, it kind of led me into also, you guys have got SpectraCell back here. I also do a lot of lecturing for SpectraCell as well. The combination of being able to be in those two formats has allowed me to sit in a lot of different practices. It allows me to see, from individuals that are starting out, just coming out of school, all the way to seasoned practitioners, and it allows me to see what it is they're doing in their practices that is effective and what it is that's holding them back. So what I want to do as we go through this, I want to translate some of what I see in different practices that is effective and that is streamlined and that gets results, but also from a business standpoint helps make you money on a day in and day out basis. Because think about this, ultimately what you're trying to do here, the products that you're bringing into your practice, you're not just using those products with the patients that are going to be walking through the door. Every one of you in here is ultimately going to go to the point of trying to set up some type of online business. You want to make sure that you've got products that are going to move in an online format as well. So we'll talk about that. So if we look at what some of the objectives we're going to focus on here, we're going to note the conditions that are core to a functional medicine practice. Look, Dr. Osborne has his niche for gluten-free. If you go to my website, you're going to see I'm all about paleo. If you go to somebody else's website, they're going to be into thyroid or whatever their niche is. But the bottom line is that if you go to any of our practices, we're going to be ultimately coming back to a lot of the same things. We're going to be addressing, we're going to hit gut function. We're going to address hormones. We're going to talk some neurotransmitters. So we want to look at what are these core areas to a functional medicine practice and look at some of the basic products that you'll need to be thinking about that you'll want to keep on the shelf that you know that you can move day in and day out. We'll look at how to narrow down your inventory to exactly what will sell. If you've got products sitting on the shelf and they're not going to sell, they're not doing you a lot of good. There wasn't a lot of point in bringing them into the practice in the first place. And I always look at this, kind of going back to, again, these seminars, we all experience this. We see a lot of good lecturers, a lot of, again, experienced clinicians standing in front of us, and they have their recommendations, and we think, wow, I should go bring that product into my practice, or I should go, that grouping of products, I want to go put those into my practice, and then you come back a month later and you look and you're like, wow, or even 2 months later, you're like, I still haven't moved these products. They're sitting here, but 60 days ago, I thought, wow, everybody that walked through the door had this thing, and I was going to move all these products. How do you prevent that? How do you stop that? So we're going to talk about how to streamline this. Inventory management. There needs to be a system in place in your office, and it needs to be out of your hands, but there needs to be a system in place in your office so that products are coming in an efficient way and they're going out in an efficient way. So I'll give you some examples of different ways that you can do that. There's not one set way, but I'll give you a couple of different ones that do work. And then, of course, a lot of you have come around and you've asked about private label. Looking at some of the benefits of private label, some of the disadvantages of it. We haven't really talked about that, and that's something you need to know too. So we'll talk about private label and then what your expectations need to be with private label and how to move forward with approaching the different vendors to get that done. So let's go through this. And again, this is probably going to be the most, if you will, clinical-oriented talk that you're going to hear this weekend. But keep in mind that we have to talk a little bit of clinical science here to understand why we're going to be making the product recommendations we're going to make on this. So this is how I think about a nutritional pharmacy. So we all live in the United States, or in North America here. I think we've got a few from Canada. So we all live in North America. And when we go, if you drive across North America, we're from Texas here, so especially if you go through Texas, you're going to see horses. In comparison to the number of zebras, there's not many zebras hanging out in Texas unless you go to a zoo or somewhere real specific, right? The point in this is that you want to have products that address the most common things that you're going to see on a day in and day out basis. Don't have products sitting there for that. Every now and again, you'll have that random case that comes in and you'll need to do a little something different for them. Maybe you'll need to make a special order to get something in for them, but that is not by and large who's walking through your practice. You're not seeing zebras every day. You're going to see those mainstream horses walking through the door, okay? So we want to think about that as we're setting this up. So some of these conditions we're going to look at here, some of the primary ones, of course, GI. You couldn't have a conversation about functional medicine if you didn't talk GI, right? Metabolic syndrome, dysglycemia, this is a big one. Probably doesn't get as significant of attention as it probably should in reality. Looking at some endocrine balances, I'm sure a lot of you in this room do some hormone therapies in your practice. We'll talk about really what kind of things to think about there. Neurotransmitters. And then secondary indicators that are going to pop up. These things like anemias and red blood cell support and stuff like that, I kind of look at this and if somebody says to me, well, I'm not really seeing a lot of that, my comment back to that is, well, you're not checking for it, because that shows up every day in my practice, literally. So it's pretty common. So you want to have things there to address that. And then we'll look at these common deficiencies and some of the core products here that cross multiple different categories. So let's look at our gastrointestinal health. So if we're looking at this and we think about some of the goals of repletion, what are we really looking at here? This is kind of that classic 4R mentality, right? What we've talked about in the world of functional medicine from day one. So you're looking to try to restore the health to the enterocytes. You're looking to try to balance that microbial environment, get the microorganisms out of there that are a problem, replete with your different probiotic strains or different beneficial fungal strains. You want to eliminate or minimize any antigenic threats. So if you get into the world of talking about different sensitivity testing, this is where something like that's going to come in, and then create immune system balance. Now, when we look at this, if you just stop and think for a second, even if you just talk to, if you look at the vendors that are in this room with regards to nutrition company, it's only a fraction of the professional vendors in the nutritional market, right? If you just ask the 3 nutritional vendors in this room, what do you have to address those 4 different points right there? How many different products are you going to get recommended on that? Just in those 3 vendors. It's pretty substantial. So we want to look at having products that, again, and I'm going to hammer this point again and again, you want products that can cross multiple different categories and get the same benefit in the end, okay? So let's look at these. So when we talk about restoring these enterocytes, it really doesn't matter what company you're looking for. The bottom line on this is that pretty much all of these products are going to be based in glutamine. Now, I'll give you some generic recommendations on this, but here's the important part about glutamine. When you're looking at someone who has gotten to the point where they have a specific need for glutamine repletion, that individual has other negative impacts that are occurring in their health also. So for example, that individual is going to be in a catabolic state. Their body's breaking itself down faster than it's building itself back up. They're losing muscle tissue. So we want to be able to give them a nutrient that's going to help offset that. Glutamine, even if you look at some of the oncology-related literature, in terms of trying to prevent and offset the effects of cachexia, glutamine is one of the predominant nutrients that is referenced in that. Looking at it from an anti-inflammatory standpoint, most people think about glutamine in terms of its direct building effects, right? So building muscle tissue, building gut health, supporting the lymphocytes. Glutamine also is directly anti-inflammatory. How many patients walking through your door don't have, with this function, don't have a degree of inflammation? They all do, right? If you go research any medical condition and you look at the correlations or the underlying dysfunction associated with that, you're going to see inflammation as a part of that condition. So having something like glutamine that can cross multiple different categories here is going to be important, and it's certainly in your neurotransmitter field, looking at it as a neuroinhibitory. Now you'll see on each one of these slides I've got a secondary consideration for you. So for example, in the restoring the enterocytes here, we could look at using some of the mucilaginous botanicals here, so things like your licorice, your okra, slippery elm, some of those classic ones, and then your anti-inflammatories here. How many of you are using the GI effects profile from Genova? Okay, good, so a couple of you. Okay, so in that particular profile, and I'm giving you this example so you guys can see how things begin to cross over. How many of you, as a part of that, would think about using broad spectrum botanicals to address what you see on that test? And when I say broad spectrum botanicals, I'm thinking about things like your strong anti-inflammatories, like your curcumin, your resveratrol, your boswellia, your garlic, your lycopene. How many of you would think to address the findings that you see on that test with that particular supplement? A few, okay? There is a marker on that test, those of you who are doing it, you'll notice that adiposity index, right? The adiposity index, in short, is basically a balance between the pro and the con microorganisms, between your dysbiotic microorganisms and your probiotic microorganisms is pretty much what you can narrow that down to. The literature is pretty emphatic on this, that for individuals that are consuming more colorful, high phytonutrient compounds, that you're going to shift that ratio in a positive direction. Well, if you think about what that means, it essentially is telling you that you're reducing the dysbiotic organisms and you're allowing for proliferation of your probiotic organisms. You didn't put probiotics in there, you didn't put any type of direct antimicrobials in there, but you still got a benefit of shifting the microbial environment in the direction that you wanted to. Now, if you just kind of think in addition to that, well, how many other different applications are there for curcumin and resveratrol? I mean, our list could get pretty endless here, right? It's pretty substantial. So you'll see that, again, these products are just going to be able to cross multiple different categories, and we don't need tons of different products sitting on the shelf to try to accomplish the same endpoint. But glutamine's your go-to here. Now, in terms of balancing your microbes, two considerations you want to look at with this. You want to look at elimination and restoration. So if we do want to get into a direct antimicrobial approach here, we've got several different options on this. But in short, I would try to look at a single plant extract. And I was thinking through this morning, and the one that I really do like in this is oil of oregano. Oil of oregano is one that a lot of different companies out there are using. If you've got gut dysbiosis, if you've got, say, ear infections, you've got a common cold, oil of oregano is something you can use. It's going to be one of those things that it usually comes in a fairly small capsule, so it's easy to get into kids. It's just a good overall generic antimicrobial that's going to be effective in knocking down some of these different microorganisms that you'll deal with. And then you can get into a combination or a blend of your antimicrobials here. So, just think about this. A lot of these will come up with GI-specific products. So if you're looking at something like maybe some wormwood and some of your berberine-containing products, maybe that's something you want to have on hand for your tougher cases. But in terms of what's going to be, if you're thinking through, you're doing your workup with your patient, and you've got that report of findings, you've done that with them, and you're thinking, okay, what's my recommendation going to be? That recommendation, as per our example here, would be oil of oregano. Now let's say that you look at that report and you're like, okay, well maybe this is a pretty tough case on this patient. Maybe there's multiple infections here that I need to address. Maybe that's when you get into your combination blend there, okay? So have a go-to and have a secondary. You can get into this situation where you have multiple different, you have olive leaf, you've got garlic, you've got oil of oregano, you've got your blend, you've got your berberine-containing compound. Realistically, do you need all of those products sitting on the shelf? Is there that much difference in the clinical outcome that you're going to get by using all those different products? Probably not. And that's another point I would stress to you is look at what the difference in your clinical outcome is going to be and make a decision based on that as well. Part of the reason I mentioned oil of oregano to you here as well is that when you look at those GI effects reports, one of the things that I've noticed, whether it tends to be a fungal infection or a bacterial infection, is that oil of oregano for the most part, and your area may be different, I'm reporting back to you what I see. Olive oregano seems to be the one antimicrobial that there's a sensitivity to just about every single time. I can think of maybe one example of recent where it didn't show up as an effective antimicrobial. And in that case, what do? You got your secondary, right? So maybe 1, 2 products, but not 5 or 6 products sitting on the shelf. It's just not efficient.